Hi, good afternoon. I'm Kelly Werfel. I'm an endocrinologist here in the Texas Medical Center. And as you can all imagine, I am a large prescriber of pharmaceutical products in the care of my patients with chronic medical problems. So I have over 20 years of practice in medicine, seen firsthand the interruptions that pharmaceutical representatives can impact on my clinic. They're disruptive, they interrupt my clinic. I'm commonly have an iPad following me around to get signatures from the pharmaceutical reps. It's not a practical model. So I was thrilled when I came to learn of our next new company, Xpress, to learn that they have a platform that's going to make those easier for me. The pharmaceutical reps are very valuable. Their information, their patient education, their product information. In the Affordable Care Act and the current insurance changes, coupons, samples, formulary products, et cetera, are very important to me in being able to prescribe the proper medication for these patients. So when I learned of Xpress and their CEO and founder, Kimberly Corbitt, I was excited to work with them and try to bring this product to fruition. Kimberly's a former pharmaceutical rep herself and understands the relationship between the physician and the pharmaceutical industry. This is her second startup and one that I'm looking forward to continue to work with and develop to help all clinicians as they work through patient problems. The Xpress platform is a business model that puts the doctors in charge of the pharmaceutical relationship. Please join me in welcoming Kimberly Corbitt.
Thank you, Kelly. So you're all halfway done. 15 years ago, I was a pharmaceutical sales rep. It didn't take me long to realize that although healthcare providers really valued the resources and information I brought to them, they didn't value me. I was one rep representing one company and able to talk about 2 or 3 products at a time. I got really frustrated quickly, and I left the field to start a business in an unrelated area. Shortly after I left pharmaceutical sales, several studies were released that talked about the ineffectiveness of the current model. Well over half of healthcare providers won't see pharmaceutical sales reps at all, and 68% of pharmaceutical executives believe that the model is broken and in need of repair. In spite of these facts, the pharmaceutical industry continues to spend $15 billion a year sending drug reps in to talk to the few offices that will still see them. That's why we created Xpress. Xpress is a customizable digital platform that allows healthcare providers to pull the resources and information they want about the pharmaceuticals that they're prescribing on their own terms. With Xpress, and in conjunction with MD Anderson, who's helping us build additional functionality, a healthcare provider will be able to launch a screen from within their electronic health record that will show them all of the drugs for a given disease state listed by formulary tier for the patient who's sitting right in front of them in a paper gown on their table, and will show what the patient's cost is for those drugs. This is a huge time saver and a huge support for healthcare providers and patients. We're able to provide this service free of charge to clinicians and to healthcare systems. The pharmaceutical industry pays us on a variable or fixed subscription basis, and if we capture just 5% of current rep call volume, our annual revenue would exceed $400 million a year. In order to build this platform, we had to build a great team. And our team has been together in one capacity or another for the last 10 years. We're all mature and accomplished, and for the last 3 years, we have listened incredibly carefully to healthcare providers. We've iterated and tested and relaunched different versions of our product in front of more than 600 healthcare providers. And we now have the perfect solution that healthcare providers tell us is exactly what they want and what their patients need. So many things about healthcare today disempower doctors. Please join us. Whether you're an administrator, a clinician, a pharmaceutical executive, or an investor, help us to put some of that power back where it belongs, in the hands we trust the most, our physicians.